when we go into that upright posture, we're breathing, expanding there, the diaphragm's being allowed to open up. We're making space for that solar plexus.
Yeah.
You know, that big bundle of nerves has a lot of influence around there. When we align the chest, head, and neck, we're making space for the vagus nerve.
Yep.
Not only that, you go further and you're expanding the rib cage, you're breathing big, you're realigning, you're opening up space for all the nerve plexuses up down the spine. Go further, we're making space for digestion. We're making space for blood flow. We're making space for the body to communicate and function with a little less pressure.
Yeah, exactly. That is low back pain. Now, many of you, I'm sure everyone out there knows someone who's dealing with some sort of low back pain, right? For many, many reasons. And low back pain can happen for, a myriad of reasons. We're going to discuss that today, okay? So we've got a couple of articles on this. So the first article that we're going to go over is from the Wellness Company, and it's a comprehensive guide to managing acute low back pain. Great article, has a lot of great tips, a lot of great things you can really think about. It talks about what you should look for as far as low back pain. What are the warning signs? What are the things you should look for to go, to get immediate medical attention versus different things. Again, it's a very comprehensive approach. And again, this is what I did. Now, again, it doesn't have to be foundation training. It could be yoga, whatever it is that you can do, but find something that you can do that can help you, again, take charge of it and get yourself back on track. Because a lot of back pain sometimes is because your muscles are weak, right? Or you're maybe favoring one leg over another, and that's causing the pain. And, again, many, many reasons for that. So just some things to think about. But I think this is a great study here because it shows that really when you work with people and put them in charge of their body, put them in charge of what they're dealing with, it actually helps them and kind of retrains their brain and actually helps their body adapt and help their brain adapt to it. Okay. So that's good hope for you guys out there. Foundationtraining.com and the membership there and what folks will get out of it when they take a look at that.
Yeah, absolutely. Thank you. It's so where people want to go if they want to explore this is ftstreaming.com. They're integrating it to our main site, but we started a separate platform. So you go to ftstreaming.com. You can do a couple weeks for free. It ultimately comes down to 50 cents a day, which I'm like, if you're like me, I'm spending more than that in coffee a day for sure. I'm a bit of a coffee lover.
Class here and really demonstrating to the audience how they can take responsibility for their health, well-being, get out of pain, and listen, 10, 15 minutes a day, you can't go wrong, right? I mean, really, it's when I was doing it that I was like, and I was used to doing breath work from yoga, from doing a lot of yoga, but again, doing those things versus doing these postures and holding it and shaking and trying to get the breath is not easy. But I'll tell you, it's so effective. Another byproduct, I think, of breathing that way that people don't even think about, it actually has a very nice calming effect on you too. You realize that I know when I do it, and if after I'm done with a foundation training session, I'm so relaxed. I feel so good because I felt like just any tension that I had from the day melted away, not just from the exercises themselves, but from the breathing. So,
the core of the body is anything that attaches to the pelvis, whether it's above or below. And
right.
So if you're only training the cliche six-pack core, you're missing 50%.
Exactly.
And that was a light switch for me. And so whenever we're hinging, when we're integrating a lot of the muscles that we talk about in this idea of anchoring. So for anybody listening, anchoring for us is where we leverage and tension the muscles that connect basically the lower limbs to the pelvis.
When I was doing it, that I was like, and I was used to doing breath work from yoga, from doing a lot of yoga, but again, doing those things versus doing these postures and holding it and shaking and trying to get the breath is is not easy, but I'll tell you, it's so effective. Another byproduct, I think, of breathing that way that people don't even think about, it actually has a very nice calming effect on you too. You realize that I know when I do it, and if after I'm done with a foundation training session, I'm so relaxed. I feel so good because I felt like just any tension that I had from the day melted away, not just from the exercises themselves, but from the breathing. So, they say exercise is a powerful analgesic, causing your brain to release natural painkillers, which can provide meaningful relief. And that's what they say here. And second, exercise helps you preserve mobility and strength so that when you come out of your back pain episode, you aren't weaker, stiffer version of your previous self. And third, episodes of low back pain often leave people very fearful of movement. Every gentle exercise helps ease that apprehension.